must have the pulse oximeter. Okay, nowadays also it is a very must acquire appliance. Pulse oximeter. In pulse oximeter, you can measure the arterial blood oxygen saturation, that is SpO2, and preferably it should be 98 to 100%. But once it gets less than 90%, then you have to consult your doctor. Okay. Then in pulse oximeter, not only the arterial blood oxygen saturation, but heart rate also measured. So these two parameters can be measured by a very portable small instrument known as pulse oximeters. And nowadays, many persons after this COVID situation, many persons they have. And regarding treatment at household basis, symptomatic treatment like paracetamol tablet, then multivitamin, vitamin C, then nasal decongestant can be used, and other drugs you might have heard also, but it is not advisable to take the self-medication. Anyway, you have to consult your doctors, like azithromycin, doxycycline, ivermectin, hydroxychloroquine, all those things are done. And in the hospital setup, there is antiviral drugs used, sometimes plasma therapy also used, all those things. Okay, so that is the treatment part. Now coming to the prevention part, because since 2019 December, now COVID is still persisting, maybe sometimes high grade, maybe sometimes low grade. So you must have heard first wave, second wave, now third wave, whether it will come suddenly or not, that is completely unpredictable. You cannot predict. Okay, so in that case, you have to be always ready to fight with the situation. So the prevention is the only way how to prevent yourself from the COVID infections. So that is called CAB, COVID appropriate behavior. Okay, CAB, you have to mention the CAB, that is COVID appropriate behavior. What are those behaviors? Firstly, you have to go for the masking. Always when you are going for any crowded place and all, you have to go for the masking. Okay, and second is hand washing. Okay, at least minimal 20 seconds hand washing every time you coming out from outside and coming in from outside or going out and all, you have to go for the hand washing. And nowadays hand sanitizers are available, different hand sanitizer, but be careful, they must contain 60% alcohol. Okay, hand sanitizer below 60% alcohol is not that much useful. Then social distancing. Social distancing is very important. Then you have to maintain the respiratory hygiene, whatever I have mentioned earlier also, like while sneezing, coughing, you have to use your handkerchief, you have to use tissues, and mask is there. Otherwise, you have to take help of your elbows. And there are surface sanitizers also available just to prevent the fomite transmission. Surface sanitizers also available. And if you have any fever, cough and cold, COVID-like symptoms, then you have to go for self-isolation so that it should not spread to other people. Then once you have the COVID, in the post-COVID situation, you must have do the breathing exercise, because mostly this disease, it affects the lungs. So to increase the capacity of the lungs, you have to go for the breathing exercise. And the tagline for COVID prevention is "Do gaj ki duri, mask hai jaruri." So you must understand the terms. "Do gaj ki duri, mask hai jaruri." मतलब क्या है? So that means 2 gaj ki duri, at least 6 feet distance among the others, and the mask is very much important. And regarding the vaccines, I believe almost, if not the 100%, 90% of you got vaccinated. Availability. Okay, according to the availability at that particular time, you have to go for any brand. Okay, so it cannot be by your own choice, rather it can be choice of the health administrators which vaccine is available. So many of you might have vaccinated the Covishield or Covaxin, whatever it is. So you must have the vaccination certificate in your mobile. You must have the hard copy as well as soft copy of the vaccination certificate, because nowadays for traveling, either air travel or so, it is very much mandatory at the airport. You have to show the complete vaccination certificate. Otherwise, in many of the airports, you have to go for the RT-PCR testing, which is not advisable, because you must be vaccinated before you come to the college. And I believe the college authority will ensure the vaccination part. so that whenever the students are entering the college or hostel, they must have the vaccination certificate. And these vaccines, they have their side effects also, like many of the people, they have fever, headache, body ache, lose motions after the vaccine, but it gets cured within 1 or 2 days, so no worry for that. So that was about the COVID. So it is a burning topic, so I discussed little more. Now the last 2 points I must highlight. One is hygiene and sanitations, and next is first aid box. Okay. So hygiene and sanitation, like water supply. So the water supply should be clean. Actually, these things are looked after by the college authorities. So no worry. I believe they will ensure everything regarding the hygiene and sanitation. Only you have to take care of your personal hygiene. So firstly, water supply, and the cleanliness of the reservoir water tank must be there periodically. Then food hygiene should be maintained in hostel mess or canteen. Then toilet, it must be cleaned regularly. Then sufficient plantation must be there. And for yourself to maintain the personal hygiene, take bath every day, whether it is summer or winter. Because nowadays many of you don't have to have the habit of taking bath regularly, so this is very much must do things for you. And clean your clothes regularly and ensure cleanliness of your hostel room. Okay, so that is at your personal level. Rest of the things will be looked after by the authorities. Now, I was mentioning in several occasions the first aid box. So whatever you must have in the first aid box, like paracetamol tablets, 650 milligram tablets, then different antacid sachets like diazepam, sachets you must have. Whenever you have acidity, hyperacidity, you dissolve it and you have it. Then hand sanitizer, nowadays must do things for everybody. Then surface sanitizer you may have, and Dettol or Savlon solution you must have. Then band-aids you must have. Then sterile gauze or cotton, it is in the medicine shop, it is available. And a leucoplast also, because why it is advisable to have this sterile gauze, cotton and leucoplast? Sometimes you may have some trauma or injury when there is bleeding from that part. So immediately what you do, you roll with that, with the cotton and gauze, and apply a leucoplast. After that you seek medical advice. Okay, so you have to stop the bleeding immediately, otherwise what will happen, you will be in danger. So that's why it is advisable. And some antiseptic ointments, whenever there is any injury and all, you must apply that. Okay, so those are the things. Analgesics, you may have analgesics, sometimes you have pain, and also in that case you might have analgesics. So all those things you must have in your first aid box. So here the time is already over. Here we have discussed few health topics, so keep these things in mind. And that's all about this. So thank you again, once again, the organizers for inviting me to deliver such a health talk. And it is a good experience with you all students. So wish you a very best of luck and a happy journey in this prestigious institute. Once again, I mention Haldia Institute of Technology.
Thank you, sir.
Thank you, sir. Thank you very much, sir. With a nice, informative, and healthy presentation towards you, my dear students. All the advice sir is given that will be required. As sir was saying that the issues which may occur in your hostel, so I was able to visualize the situation, what normally happens. Everything's what we intended to say you later on, sir already has informed you. So thank you, sir. And sir was associated with us several times. And actually, he is not only associated with us, he is one of the parent of our one student. So it's a nice interaction with the students, sir. Thank you very much, sir, for giving me us so much time. Thank you, sir.
Thank you. So I should leave. Okay.
Thank
Bye.
you, sir. Yes, sir. You can leave, sir. Okay. Now, actually, the students, we have another session for today, but due to some issues, we are not able to continue the session from 3 p.m. onwards. So for today, the session is going to be end here, and all of you are requested to leave. And from next day, tomorrow morning, as the timing, from 8 a.m. We are going to start again from tomorrow. And probably tomorrow may be the last day for this. During that, after that, we'll come again with the follow-up programs that will occur on 1 hour per day, 1 hour morning or evening session. So the required schedule will be with you very soon. Today's interaction in your mentoring classes, already all of you have got informed that how you are going to get syllabus, and what will be the nature of your study or nature of your examination. And also for tomorrow, you will have to come up with the feedback, how you feel during the session, and some of the expectation. A questionnaire or a feedback form will be with you, and you have to fill up it. So thank you for nice cooperation. And with the permission of Anupam sir, may we conclude here for today's session?
Yeah, so today's session we will be concluding here, and there was some interruption in the YouTube streaming, so don't worry, the YouTube listener. We'll be uploading this recorded video in the YouTube channel, so please follow the channel. It will be available there.
Okay, due to internet interruption, we were not able to continue the same video in one YouTube link. So, but very shortly we will get it, and one link it will be uploaded very soon. So, better to be with that channel. Okay, thank you very much. You can leave now. You please leave, Shubhajit. You can leave.